Medicare is wonderful insurance if you're going to the hospital or skilled nursing or seeing a doctor or having a surgery. But when it comes to dental, Medicare, frankly, is lousy. And so you have to be prepared for it because Medicare excludes almost all dental services. So the first thing I want to address is what will Medicare cover for dental services. First off, you have to realize it is going to be very, very limited. Very limited. And the reason for that is because in 1980, Congress actually passed a dental exclusion statute. And so that's why since 1980, they rarely are going to cover anything dental related. Certainly not extractions and fillings and just the normal kind of things that the average person needs to have proper dental care. And so I want to read right from their website because I think this describes it well as we talk about this very limited service for dental when it comes to Medicare. And here's right from their website. It says this: currently, Medicare will pay for dental services that are an integral part either of a covered procedure. So in other words, it's got to be tied into something else that Medicare is going to cover. And their example is the reconstruction of the jaw following some type of an accidental injury. So we have an injury to the jaw and they're going to have to do some operation and probably some reconstruction of the teeth. Medicare is going to cover that. They also would pay for extractions that are done in preparation for radiation treatment with diseases that involve the jaw. So we've got some kind of, cancer or some issue going on with the jaw disease. Well, then if there have to be some extractions, Medicare says because they're going to cover that medically necessary jaw surgery, they also cover the dental that's involved with extracting the teeth. Medicare will also make, listen to this one, payment for oral examinations preceding kidney transplants or heart valve replacement. And so what you can see under very strict circumstances, Medicare is willing to pay for dental services. But as a general rule, as you can see, it's going to be very, very limited to these type of situations. And so that's why you have to be prepared. And so we actually have three different options or three different ways in which we can make sure that our dental services are going to be covered. So our first option is actually simply to self-pay. This means that we're not going to get any kind of a dental plan, dental insurance. We're just going to pay out our pocket. And frankly, about half of all people that are on Medicare, this is what they choose. And typically we see this when people have real healthy teeth. They rarely do anything except maybe go in once a year or twice a year for cleanings. And they say, typically my cleanings are going to cost me less than what I pay in a premium. I've had no other dental issues that have surfaced. And so they are fine simply being a self-payer. Now, I would tell you, if you decide to self-pay, you may want to ask your dentist if they have some kind of an internal plan, because sometimes a dentist will put together his own plan, cover maybe 1 or 2 cleanings a year, and give you a discount on other services that you may need. All right. And again, if you're going to do the self-pay, you're just simply say, don't want any insurance, don't think I need that, and I'm just going to pay for that on my own. So that's certainly a viable option. And again, half of all people on Medicare, that's what they choose. Now, another way in which a person can get dental services covered is when they enroll into an Advantage plan. And just as a quick reminder, when we go on Medicare, we can either choose to have A and B with a supplemental plan, or we can enroll in A and B and we get a C plan. We actually replace Medicare with an Advantage plan, which is a private health insurance company. All right, those are your two options when you go on Medicare. And so if I have that C plan or that Advantage plan, what happens? Almost always that Advantage plan is going to include some type of a dental benefit. Now, I don't like to call it a dental plan because it's really not a true plan. What I refer to it is, more accurately, is a dental allowance. A dental allowance. Now, keep in mind, if you are on Medicaid and you get what we call a dual plan, which is Medicare, Medicaid eligibility, your dental allowance could be fairly attractive if you're on Medicaid. Again, not many people are. So if you're not on Medicaid, what's going to happen? This dental allowance is typically, on average, right now throughout the country, about $1,000 a year in coverage. Now, you have to ask some questions about that dental allowance. Number one, for the $1,000, do you have to go to a network dentist? Sometimes sometimes they require that, sometimes they don't. But if they do, you're going to have to make sure that your dentist is in the network, or you're going to have to switch dentist to take advantage of that $1,000. All right, now that $1,000 typically can be used for whatever you want. It could cover a couple cleanings, maybe an extraction, a partial crown or something. But once that $1,000 has been exhausted, then that's done for the year, and then they'll replenish that account in January, and again, you have another $1,000 the next year. So you got to find out, do I have to go to a network dentist? What can I use my $1,000 for? Typically for anything that you want. And then you have to find out how will the claim be filed with the insurance companies. Because if that dentist is not in the network, then typically what happens is you're the one that has to pay the bill. And then what you'll do is you'll fill out a form, and they will actually reimburse you for your out-of-pocket expenses for covered dental services up to whatever the limit is on that plan. Okay, and so that's why I don't really call this a dental plan, but it certainly is a dental allowance. And if you have an Advantage plan, then you certainly want to take advantage at least of that $1,000 of services that will be covered on an annual basis. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. And then that brings us to another option, our final option, and that would be for you to actually get private dental insurance coverage. You buy a dental insurance plan. And so there are a lot of companies who offer these plans, and what I want to teach you about is how they are structured, because all of them are very similar in structure. So what we have is we have three types of services. First off, we have preventive services. So your preventive services on the private dental insurance plan is going to be usually a couple cleanings a year. They'll give you one set of x-rays on an annual basis. And when we get a plan, that preventive services is normally covered day one. In other words, that's really an immediate type of coverage. Occasionally, we'll have a plan that requires that the very first services you have, even if it's preventive, you may have to pay a deductible. Those deductibles are typically about $50. And sometimes that deductible does not apply on preventive, and sometimes it's just on other services. But you need to know most of the plans have some type of a small deductible. So preventive services, again, cleanings, x-rays, those kind of things covered day one, and they're covered at 100%. Other than the deductible if it applies. And again, usually it does not, but I just want to mention just in case your plan did. So that's the first type of services. Then the next type of services are actually called basic services. And I just simply describe these as things that are very low cost. These are going to be extractions. These are going to be fillings, those types of things. In other words, these aren't really high dollar type items. And these are normally covered by a plan at 80-20. So what that means is the plan would pay 80% and you would pay 20% of that bill. Okay, now keep in mind, some plans actually have a waiting period for these kind of services. They may not cover these services for 6 months. All right. Now, one of the plans that we really like is in a plan that actually covers immediately, but it's kind of a progressive benefit. So like day one, it covers it at 60% or maybe 80%. And then after 1 year and 1 day, it covers it at 80% or 90%. So it's just kind of an increasing benefit. But again, basic services, low cost items, you pay 20%. And sometimes you have to wait 6 months, or maybe you'll have this progression in the benefit over time. Okay? And so that's basic services. And lastly, what we have is the third type of services that are referred to as major services. Now, these would be things like root canals and crowns, periodontal type work. Some plans you actually include implants in this. And so the way this typically works is, so again, we're talking about, more of your, high dollar type of things. And so what's going to happen here, this is typically paid at 50-50. So plan pays 50 and then you pay 50%. All right. Now, some plans actually will not cover you on this until 12 months. Now, some of them will have a kind of a graduated benefit. One plan that we see a lot of is a plan that actually day one will cover you. Plan pays 20, you pay 80. And then after 1 year and 1 day, plan pays 50, you pay 50. So again, it's that graduated increase in benefit. But again, you have to find out, is there a waiting period? What will be covered when it comes to these major services? And will also include implants. All right. And so what's happening with these plans, 3 types of services, and then lastly, they're going to set an annual benefit. And again, most of the plans that we write are going to be somewhere between $2,000 to $2,500 a year per person. Now, some plans of that maximum annual benefit that they'll spend on you during that 12-month period includes cleanings. One of the plans we really like a lot does not. It gives you $2,500 a year in services for these two items, plus 2 cleanings a year. And so those are kind of things that you've got to consider and really look at. Now, most of the plans are going to have a premium, of course. You're paying, insurance for it. And again, this is going to vary around the country, folks. But I would say on probably the low side, you're looking at around $40 a month for a plan. And maybe on the high side, maybe, $55, $60, 65 a little high. But I'd say just around $60. And this would be per person on a monthly basis. And this certainly varies depending upon what part of the country you're in, whether you get a $2,000 plan or $2,500. But I call this a true dental plan. As I said, the Advantage plan is more of an allowance, $1,000. And so these kind of things here are truly plans. Now, again, you may not want to spend that money, and you certainly don't have to. You can self-pay. But if you do have some teeth problems, it's very likely that you're going to get your money back out of that. Because if I paid $40 a month, that's what, $480 for the year. They're going to spend between $200 to $2,500 on an annual basis for me, because it's going to reset every 12 months. All right. And so these are the ways to get your dental covered. Obviously, we've seen Medicare is not going to be much help unless in an extreme circumstance. So you have to be prepared to self-pay, do an Advantage plan, or get your own dental insurance plan.